Welcome, and thank you for joining me today for the workshop, Your Next Patient Has Autism. I'm Lika Anzaldo, and I'm Training Manager for Autism Society of North Carolina. Today we're going to talk about several things. For the most part, I really want to increase your understanding of those behaviors that may be associated with autism spectrum disorders, because the better you understand it, the more successful that patient may be during a medical appointment. We're also going to talk about some environmental and sensory factors that may be implicating the individual with autism spectrum disorder during an appointment, and how that can cause some of those unusual behaviors that you may be seeing or witnessing. Also, we're going to talk about ways to address these factors simply, making very simple adaptations to the environment that may be causing the patient discomfort. And then finally, we're going to become familiar with those strategies that are going to result in more successful and productive appointments. So when I say autism spectrum disorder, what's the first thing that comes to mind?
Challenging.
Challenging.
Puzzling.
Puzzling. And there are lots of different things, I think, that come to people's mind when I say autism. It's all over the media right now. So it's hard to even watch something on television without autism being hinted at in some way. Even regularly aired television shows now star main characters who have autism spectrum disorders. But from that, you still don't understand clearly what autism is all about. And one thing that I'd like you to take away from this slide is that autism is neurobiological by nature. So this is a brain function. Individuals with autism spectrum disorders' brains work very differently than our brains work, process information differently than our brains process information. And because of this may be why we see some of those behaviors and differences in communication. But the main differences that we see on the surface are going to affect the individual's ability to understand and use language, to communicate especially, understand and relate to people and events and objects, the way that they respond maybe to sensory stimuli, and also just the pattern of learning and thinking may be very different than an individual who is typically developing. So you may have heard of autism being described as a spectrum disorder. And that's because there are many different characteristics that kind of fall within the spectrum. And really, if you've met one person with autism, you've met one person with autism, because autism looks very different from individual to individual. The range of IQ for individuals with autism can be from severe to genius. So in the past, when I've brought up the word autism, lots of people immediately think of like Rain Man and the savant skills. And that's not typical. That's kind of the person who's out of the ordinary, maybe with Asperger's or autism. But it does differ from intellectual disability in that intellectual disabilities are categorized by sub-average intellectual functioning, whereas this is not a main category for autism spectrum disorder. So under the spectrum, currently, there is autism diagnosis, also pervasive developmental disorder not otherwise specified, or PDD-NOS, as well as Asperger's syndrome. And we're going to talk about each of those. But some parents may come to you and say that their child has high-functioning autism. And this isn't a specific diagnosis. This is not listed in the DSM-IV as a diagnosis. However, it does describe as individuals with autism who may have some language skills, who may have some pretty good social skills, but they don't quite meet criteria for Asperger's. So it's just a better way to describe maybe some individuals who have a higher level of functioning. So currently, the definition predicts that out of every 88 children born, one will be diagnosed with an autism spectrum disorder. This is a huge leap. When I started with the Autism Society in '96, it was 1 in 1,500. That's a giant jump. So why is this happening? That's the big question that's looming over everyone's head. Over 1 million children in the United States are affected by autism, and that includes Asperger's. In North Carolina, the number is even higher, with 1 in 70 children with an autism spectrum disorder. So it's going to be impossible for you to not come in contact with an individual with autism. And I think it's so important that our community become more aware so that we can best support those individuals. The diagnosis of autism has jumped 23% in just the last 2 years. And boys are now 5 times more likely than girls to be diagnosed with an autism spectrum disorder. And I, as a parent of 2 boys, that was very alarming to me. As well as many of my colleagues also who have children. So why is this happening? What are the sex differences with autism? So when I ask the question of an audience, what causes autism spectrum disorder, I usually get a menu of different causes. I think the most recent one that I've heard, which I had never heard before was that they were told that carpet fresh causes autism. So lots of people have their theories, and I'm not discrediting anything. However, one thing I do want to touch on is that vaccines do not cause autism. That information that was made public by Dr. Wakefield has been recanted, and there's no evidence to support that. So very, very important that you stress to families that they have their child vaccinated, because measles, mumps, and rubella are deadly. But there are lots of things that are happening to the central nervous system of children that may be causing or exacerbating their autism symptoms. Starting with metabolic imbalances, how they're processing things that are coming into their body. And then the genetic piece. Lots of research has been dumped into the genetic research, and it has proven that there are genetic predispositions to autism. Individuals who have twins, for example, if one twin has autism, the other twin is much more likely to have autism as well. Same thing holds true for individuals who have one child with autism and then have another child. They're more likely or at higher risk to have a second child with autism as well. Also, certain drugs that are taken during pregnancy, those have been linked directly to autism, such as valproic acid and thalidomide. And then the environmental piece, which is getting a lot more attention these days. We think about what's in our environment now that we're bombarding our systems with on a daily basis, such as pesticides and antibiotics in our food, all these things that maybe weren't present, many, many years ago. And then just with, the theories around global warming and particulates in the air, when you have a very young